I'm Dr. Aeden Bernice Timbol. I'm a doctor practicing physician from the Philippines as a gastroenterologist. And I came here to Mahkota Medical Center for my HIFU treatment. I knew about my uterine fibroids, I think 5 years ago. But at that time, they were very small and it didn't bother me so much until the past 2 years. When I got married and we were trying to conceive, that's when I noticed my menses was very strong. I had pain in my lower abdomen, and I usually consume a lot of maternity pads. So the flow was very strong, and that's when I knew that the fibroids were getting bigger. When I heard about the HIFU treatment as an alternative for my uterine fibroids, I was actually very relieved and happy that I won't be undergoing a surgical procedure that would have some scars in my uterus. And I think for me as a doctor, that's my best choice for conception or having a baby later on, because I don't have any scars. So I was very hopeful, and it's a good thing that Dr. Selva was very open to my questions. He was also very optimistic about my case. The day before my HIFU treatment, they brought me to the HIFU simulation. It's basically the same HIFU procedure, but at least you're awake. They get to measure my fibroids. That way, he would know, even a day before the HIFU procedure, he would know the exact locations of my fibroids, if it is doable, if there are things that he needs to look out for. So I think that's a very good preparation. On the day of the procedure, it took me, I think, an hour and a half to 2 hours for my case. I think it depends on the case of the patients. But for mine, because I had 2 large ones and multiple ones surrounding them, it took, I think, Dr. Selva 2 hours, because he patiently hit almost more than 95% of my fibroids. I think for me, the most important part of this journey was the way I was given hope for a non-invasive, non-surgical procedure that offered a very safe and successful treatment.